I will be showing some of the perhaps most common biological complications associated to certain procedures that I see in today's private practice, and that could be prevented if we take certain steps to avoid the development of biological complications. What can affect the longevity of the implant and what can lead to a successful clinical outcome? We are dealing with biology. Sometimes implants that are healthy for a number of years may develop a peri-implant disease as a result of changes in the lifestyle of the patient or other medical issues that can impair peri-implant health. In any case, this video is not meant to address in detail all the potential different factors that could affect the longevity of dental implants. Please don't forget to leave any comment in the section below, and please subscribe if you deem these videos interesting. Thank you. Two central incisors, two right central incisors. Implants were placed years ago, the one on the left over 21 years ago, and is considered a success. The one on the right is considered a failure. Still, after 8 years, the implant is hanging in there. Why these implants are considered a success or failures? These are the clinical pictures. Why this case, the case on the left, is considered a success? One of the reasons is the implant is fully osseointegrated and the surrounding tissues are healthy because the surrounding bone around the implant is healthy. Bone loss and lack of osseointegration associated with implants that had received bone substitutes. So the lack of new bone formation seems to be a significant factor in failure and implant complications, biological complications. The other one that we could discuss as well is bacterial contamination or infection that could lead to also unhappy tissues, abscess formation, and so forth. The prosthetic design, it is also important. There is a number of research publications leading us to believe that the prosthesis, the implant supported restoration, is key in maintaining health. Also, another risk factor that has been mentioned in the literature quite often is the excess of cement. So we could argue whether cement retained restorations can lead to more biological complications or not. But one of the trends that I see more and more in private practice is the lack of facial bone formation. And many times this is associated with the abuse of certain biomaterials that could impair new bone formation. When a tooth is extracted, a coagulum is formed, and there is going to be an apical-coronal new bone formation. The strongest bone fill occurs at the apex of that socket. And as we move towards the crest, there is less potential for new bone formation. We have to favor and enhance, especially at the crest, because it's the most aesthetic area. We want to enhance the healthy bone. So we could see more aesthetic complications if that crestal aspect does not have healthy bone.